Assalamu alaikum. Welcome everybody to my channel AnatomyMentor. And today I'll be discussing with you the gross anatomy of the medial compartment of the thigh. So as you can see, these learning objectives are in front of you. Today we're going to be discussing the contents of the medial compartment of the thigh, as well as the attachments, nerve supply, and action of the muscles over here. We'll be talking about the cutaneous and muscular innervation in the medial aspect of the thigh and discussing the course of the major blood vessels and their branches. And we shall also talk about the boundaries, contents, and clinical significance of the adductor canal. So starting with today's topic, let's just look at a brief summarized list of the contents of the medial facial compartment of the thigh. The muscles in this compartment are gracilis, adductor longus. You can see over here is the adductor brevis, the adductor magnus, and obturator externus. Blood supply in this compartment is by the profunda femoris artery, which is the deep branch of the femoral artery, and also the obturator artery. Whereas the nerve supply in the medial compartment of the thigh is the obturator nerve. Now looking at the surface anatomy of the anteromedial aspects of the region of the thigh, we can see on the anterior aspect, this prominence is representing the rectus femoris muscle, which we had discussed previously is a muscle of the anterior compartment of the thigh. And the mass on the lateral aspect of rectus femoris, this represents the vastus lateralis. Now, if we come over here on the medial side of the rectus femoris, just beneath it, this is the location where you can see the laser pointer over here of the vastus intermedius muscle. And then here is the medial compartment of the thigh, where you can see this represents the adductor longus. So if we just look at the summary of these muscles which are present within the medial compartment of the thigh, we start by looking at the gracilis. Now, the gracilis is a slender-bodied muscle. Its origin is from the pubis of the hip bone as well as the ischium of the hip bone. And you can see it is inserted into the tibia on the upper part of its medial surface. And this gracilis muscle is supplied by the obturator nerve, which is the nerve of the medial compartment of the thigh. And before coming to the actions, let's just look at the other muscles in medial compartment. We have the three adductors, longus, brevis, and magnus. Now, these are the three adductor muscles in the medial compartment. And their origin is from the hip bone, right? Adductor longus is from the body of pubis and just medial to the pubic tubercle. Whereas adductor brevis is coming from the inferior ramus of pubis, and the adductor magnus, along with the pubis, it is also originating from the ischium and the ischial tuberosity. Now, when we talk about the insertion of these muscles, remember they will all be inserted into the femur bone. The adductor longus and brevis, they're all inserted into the femur bone. This is the linea aspera. We talked about it before. It's a prominent ridge on the posterior surface of the femur, which receives the insertion of adductor longus and brevis. And in addition to that, keep in mind the adductor magnus is also inserted into the adductor tubercle of the femur. If we look at the nerve supply, longus and brevis are both supplied by obturator nerve. Adductor magnus has two portions, and one of them is supplied by the obturator nerve, that is known as the adductor portion, that is present in the medial compartment of the thigh, whereas the other portion, which is the hamstring portion, which is present in the posterior aspect of the thigh, this is supplied by the sciatic nerve. So that's what you've got to remember about the adductor magnus. Magnus word means large. So this is a large prominent muscle, and it has two parts, one of which is in the medial compartment of the thigh and the other which is within the posterior compartment of the thigh. So then we come to this here obturator externus. This is a muscle which is sometimes included within the medial compartment. Its origin is from the outer aspect of obturator membrane and the adjoining parts of the pubic and ischial bones. Then we can see its insertion is into the medial surface of the greater trochanter of the femur. Obturator externus is also supplied by the obturator nerve, which is the nerve of the medial compartment of the thigh. Now, what about the actions of these muscles? Generally speaking, keep in mind that the muscles which are present in the medial compartment of the thigh, they are all adductor muscles. So you can see over here, gracilis, adductor, longus, brevis, magnus, they are all going to perform the action of adduction at the hip joint. So this action of adduction is being performed at the hip joint. That is, the thigh is going to be brought closer to the midline. That is the action of adduction performed by these muscles. Now, in addition to that, these muscles, gracilis, you can see over here, the gracilis only will also flex the leg at the knee joint. So this is an additional action that gracilis is also going to flex the leg at the knee joint. These adductor longus, brevis, and magnus, remember, are also lateral rotators of the thigh at the hip joint. So this is their additional action, that they're also lateral rotators of thigh at the hip joint. And since I mentioned that adductor magnus has a portion which is present within the posterior compartment of the thigh, that is the hamstring portion, this portion has the action of extension of the thigh at the hip joint as well. So these are the actions, whereas when we talk about obturator externus, just remember it is a lateral rotator of the thigh at the hip joint. So this is what we have to remember about these muscles. And if you want to keep the actions in mind, you can also keep this in mind, that the gracilis is the only one which is flexing the leg at the knee joint, because the insertion of the gracilis, you can see, is on the tibia, whereas all the others, they are inserted into the femur only. So this explains the action of gracilis at the knee joint in addition to the hip joint. Okay, so now that we have talked about these muscles, we're going to move on to a little detail in which we'll be looking at these portions of the hip bone which have been color-coded to show us the origin of the muscles of the medial compartment of the thigh from the different parts of the hip bone. And you can see over here that from the inferior ramus of the pubis, the adductor magnus has its origin. You can also see over here that from the pubis, you can see the origin of pectineus over here. You can also see the adductor longus and the adductor brevis, their origins over here. And the gracilis over here, marked by the purple line, it also has its origin from the hip bone. Now, this light blue shade represents the origin of the obturator externus muscle. And all of these muscles, their insertions are also represented by the same color, the color of origin. So you can see that this green line over here is the attachment line on the linea aspera, which is showing the insertion of the adductor magnus muscle on the posterior aspect of the shaft. And then medial to it, you can see the insertions of adductor brevis onto the linea aspera. And also you can see the insertion of the adductor longus, which is inferior to the insertion of the adductor brevis. Here is the attachment line to the pectineus muscle, which has also been shown over here, because the pectineus is a muscle based on its location. We can include it in the medial compartment of the thigh because it is present over here. And beneath this pectineus, now you can see, is the adductor longus, and also you can see the location of the adductor brevis. And we can see that these are the muscles which are present now in the medial compartment. And here is the vessel of the medial compartment. I told you that's the profunda femoris artery, which is the deepest branch of this here femoral artery. And this is the main blood vessel which is present in the medial compartment of the thigh, supplying the muscles and all the adjacent soft tissues. Okay, so obturator externus, which was included in this medial compartment, I told you its origin is from the external aspect of obturator membrane, and it is inserted into this here medial aspect of the greater trochanter of the femur. Now, something to remember about this muscle is that on the basis of its location, it is considered to be a part of the medial compartment of the thigh. but on the basis of its action, it can also be considered a part of the gluteal region. Similarly, when we talk about the adductor longus, this is a muscle which is considered to be a part of both the anterior and medial compartments of the thigh. So based on its location, we can include it in the anterior compartment, but on the basis of its action, you know it's an adductor of the thigh at the hip joint. So on this basis, it is better to include it in the medial compartment of the thigh. This is a slide showing us the cutaneous innervation on the medial aspect of the thigh, and that is the obturator nerve as well. You can see it is supplying the medial skin on the medial aspect of the thigh. The blood supply I already showed you was by this profunda femoris artery, which is, you can see, the deepest branch of the femoral artery. And the branches that it further gives off are the medial and lateral circumflex femoral arteries, as well as the four perforating arteries. This here femoral artery, when it has given off the profunda femoris, it travels, you can see, first through the femoral triangle, and then eventually it will reach on the posterior aspect of the knee. So we will be talking about that in the next few slides. So here comes a very important region in the medial compartment of the thigh, and this region is known as Adductor Canal. Now, what is the Adductor Canal? You should know that this is a very important topic for the surgeon as well, for the anatomist as well, and for students who are studying the gross anatomy of the thigh region. This is a very commonly asked question, and the Adductor Canal, keep this in mind, is an intermuscular cleft or a tunnel which is located on the medial aspect of the distal 2/3 of the thigh. And it is lying beneath the sartorius muscle. So therefore, the adductor canal is also called the subsartorial canal. It extends from the apex of the femoral triangle to the opening in the adductor magnus muscle, and this opening is known as adductor hiatus. So if you listen to my lecture on the anterior aspect of the thigh, in which we previously talked about the femoral triangle in much detail, you can then connect that previous knowledge with the adductor canal, that the starting point of adductor canal is the apex of the femoral triangle, and it ends at the opening in adductor magnus muscle. So this here is showing us the region of the femoral triangle. This is the base of femoral triangle formed by the inguinal ligament, and here is the apex of the femoral triangle. The apex of the femoral triangle is the point where the adductor canal region starts, and you can see this region of adductor canal is present in the distal 2/3 of the thigh. So it is on the distal 2/3 of the thigh, it is on the medial aspect of the thigh, from the apex of the femoral triangle to this distal point, which is better shown in this slide over here as the adductor hiatus. That is the opening within the adductor magnus muscle. So this is the adductor magnus muscle. You can see its origin from the ischium and ischial tuberosity, and its insertion is into posterior aspect of the shaft of linea aspera, the posterior aspect of the femur, which is linea aspera. And this here is the opening in the lower region of this adductor magnus muscle. This is the hiatus. Now, when we're talking about the adductor canal, you should know the boundaries of the adductor canal. I told you this is a region which is present beneath the sartorius muscle. So anterior boundary is formed by the sartorius muscle and the subsartorial fascia. And this here is the prosected specimen in which this pointer is pointing towards this muscle highlighted in red, which is the sartorius muscle. So if we remove this muscle, beneath this muscle would be the region which is known as adductor canal on the medial aspect of the thigh. And if we look at its lateral boundary, the lateral boundary is formed by this muscle over here highlighted in red. This muscle is the vastus medialis. So vastus medialis is forming the lateral boundary of the adductor canal. Whereas posteromedially, the boundary of adductor canal is formed by the adductor longus muscle superiorly, and this here adductor magnus muscle inferiorly. So this here is the adductor longus and this here is the adductor magnus on the medial aspect of thigh. They are forming the posteromedial boundary of the adductor canal. Now we can summarize the boundaries which are visible over here. Anteriorly, you've got the sartorius muscle. Laterally over here is the vastus medialis. And, and medially over here are the adductor longus superiorly and adductor magnus inferiorly. These are the boundaries of the adductor canal. Now, what about the contents of adductor canal? Within this adductor canal lies the femoral artery. You know, this femoral artery was present in the femoral triangle. Now, after leaving the femoral triangle, it enters the adductor canal. So this here is pointing towards the femoral artery within the adductor canal. And if we look deeper within the adductor canal, we will see the femoral vein is also accompanying the femoral artery. So the femoral vein is present deeper to the femoral artery. And also keep this in mind that this is a close relation. As you can see here, the femoral vein is lying on the deeper aspect, or we can say the femoral artery lies anterior to femoral vein within the adductor canal. Also present within the adductor canal is the nerve to the vastus medialis, as well as the saphenous nerve. Let's talk about the saphenous nerve now that we have mentioned it. It's the largest cutaneous branch of the femoral nerve. It supplies skin on the posteromedial surface of the leg, and it passes anterior to extensor retinaculum and medial malleolus, supplying skin on the medial side of the foot as far as the head of the first metatarsal bone. So that is the region of the ball of the big toe. This is a cross section through the middle of the left thigh. And when we are taking a cross section, we can see that this here is the femur bone, which has been transected, and the muscles which are lying on the medial aspect of the left thigh. These are the muscles which are the adductor muscles. And you can see that this area which has been outlined as the triangle-shaped area is representing the adductor canal. Now, let's look at the boundaries again in the cross section. So we said that this adductor canal on its lateral side is this muscle, which is the vastus medialis. So it is forming the lateral boundary of adductor canal. Whereas posteromedially, we can see is the adductor longus shown over here. And then from above or anteriorly, we could say is the sartorius muscle over here. And within this adductor canal are the femoral artery and the vein and the saphenous nerve and the nerve to vastus medialis. These were the contents of the adductor canal. Now, this is an important point to remember. The femoral vein, it lies lateral to femoral artery at the adductor hiatus. So these are the relations. If you recall the previous topic, when we were discussing femoral triangle, if you recall the relations of femoral vein and artery over there, the femoral vein was lying on the medial aspect of the femoral artery. Now what happens is, as these vessels, they pass through the femoral triangle and then they enter the adductor canal, the relation changes. The femoral vein now would be lateral to femoral artery at the adductor hiatus. So you can see the relation has now changed as the femoral vein and artery have passed through the adductor canal. The vein, which was previously on the medial aspect of femoral artery, has now come to lie on its lateral side. So at the exit point of the adductor canal, that is the adductor hiatus, the femoral vein is now lying lateral to femoral artery. And then as it passes posterior to it in the adductor canal, it comes to lie medial to the femoral artery in the femoral triangle. So we can take this in a direction from below upwards, or you can see it in a direction from above downwards, from the femoral triangle to adductor canal, or you can consider it from the adductor canal towards the femoral triangle. But anyhow, the relation changes. The adductor canal is the passageway for neurovascular structures. basically those structures which are passing from the anterior region of the thigh to the posterior aspect of the knee. So eventually these femoral vessels, as they lie on the posterior aspect of the knee, will now be called the popliteal vessels. Okay, so let's talk about the applied aspect of this very important region, which is the adductor canal. The first thing you should know about is the adductor canal block. Local anesthesia can be produced by blocking the saphenous nerve in the adductor canal, and that this produces a region of localized anesthesia on the medial aspect of the lower 2/3 of the thigh and the upper part of the medial aspect of the leg and the knee. So certain procedures can be performed after performing this local anesthesia. Another condition, which is a rare condition that can happen, that can take place, the clinical condition is known as adductor canal compression syndrome. Now, what happens is that, the important neurovascular structures are there within this adductor canal. They can become entrapped. A rare cause would be the hypertrophy of the muscles which are surrounding the adductor canal, especially the vastus medialis muscle. This can cause compression effects, which can be due to the compression of the saphenous nerve, which can cause the effects in the lower limb. Also, there is the femoral artery over here. Compression of femoral artery can cause claudication. What is claudication? Claudication is a cramping sort of pain in the limbs, which is experienced due to the compression effects on the artery, and it is especially induced during time periods of exercise. So that is the claudication. Okay, so now we have actually covered the basic anatomy of the medial compartment of the thigh. We have talked about the muscles over here, the nerve supply, and we've also discussed the very important adductor canal. Now, here's an MCQ for you, and I expect that the answer should be quite straightforward. During an abdominal hysterectomy for a cancerous uterus, the obturator nerve was accidentally severed. This resulted in the patient losing which of the following actions? So here you've got the list of the options in front of you. If the obturator nerve is severed, which of the following actions do you think would be lost? So we know that the obturator nerve is supplying the muscles in the medial compartment of the thigh, which are the adductors of the thigh at the hip joint. So option A is the correct answer. This is the action which would be lost. Here's the other MCQ, MCQ number 2. A patient comes to you complaining of his inability to stand on his tiptoes. Which of the following nerve injuries is most likely to be involved? Now here the patient is unable to stand on his tiptoes. So when a person stands on their tiptoes, we know that the foot, it moves posteriorly, or we could say that the sole of the foot is moved posteriorly. This action which is being performed of the foot is known as the plantar flexion. Now the plantar flexors are present in the posterior compartment of the leg, and they are supplied by the tibial nerve. So this is the nerve injury most likely causing an inability to stand on the tiptoes. A 32-year-old woman is brought into the emergency department because she is unable to evert her foot at the ankle. Now, which of the following nerves is most likely to be involved? Here, the loss of action is the loss of eversion, which is a movement of the foot towards the outer aspect in which the sole is also lifted and moved externally. So this is the action which is performed primarily by the everters of the foot at the ankle joint, and these are peroneus longus and brevis, which are present within the lateral compartment of the leg, and they are supplied by the superficial peroneal nerve. So this is the nerve which is most likely to be involved in this scenario. So these MCQs were not just from the medial compartment of thigh, but also inclusive of the general gross anatomy of the leg. And I hope this helped you understand this topic in a much better way. I will be coming again with more lectures about the other compartments of the thigh and the leg region, and we will be continuing this discussion. So if you found this video helpful, and please like and subscribe to my YouTube channel, which is AnatomyMentor, and you can do that by simply clicking on my picture, which is going to appear at the end of this video session. So thank you for your time, and I hope this was helpful for you. Stay sharp and stay blessed. Allah Hafiz.